everyone, and welcome to Endas Cares. So first, I want to thank you guys for liking my healthcare page thus far and following. This video will be a short introduction on what is Endas Cares and what are we doing. So first I want to start off by saying, what does Endas Cares mean? And it means ending all stigma care. So how did that name come about? Is one, by my grandmother. Her name is Edna Johnson, and I actually misspelled her name, but instead of changing it, I came up with an acronym that will be beneficial to the community and everyone. So even though it was meant as a legacy to honor her, which it still will be, but it came out to be something more meaningful and soon to be impactful by me, the research, and the work that I'm doing. So I first want to say that I am a public health major. I graduated last year with my bachelor's in public health, and the main reason why I started my healthcare page, one, is to educate, and also one day I plan on hopefully owning a clinic, but right now, since I'm in the field where I'm constantly learning about different things, different resources, I can use my platform to educate. I don't have to be broad. I don't have to be contained to one topic. I can expand and talk about anything and everything long as it pertains to stigma. So again, my name is Michaela Drake, and I am the founder of Endas Cares. I'll be using social media, my healthcare page, YouTube, different resources to educate different people, different populations on stigma and how can we combat stigma, how can we reduce stigma, where healthcare is equal and just as equal in quality at the same time. So everyone deserves access to medical care without shame, fear, or judgment. So first, we're going to talk about what is stigma. Stigma is the invisible weight people carry. Stigma can silence someone with anxiety. It can also isolate someone from seeking medical care. It can make asking for help impossible. It can make individuals seen invisible, not heard, and not valued. They also can feel not trusted. Stigma is also a belief about something or someone that is not correct. Oftentimes when we think of stigma, is something that we, or healthcare in general, has first came out with the definition, and now we're kind of trying to combat stigma. When you think about different viruses, infections, diseases, now you're seeing people in the healthcare field having to come back and break barriers and redefine these different things in healthcare. So our goal with Endas Cares is to, one, not to just come up with a definition, not to come up with a solution, just understanding and briefing and educating everybody about what is it in the first place. Why is this disease or infection? Where did it come from? How can we treat it? How can we solve the issue if there's no issue or treatment available, instead of just coming out of the blue with some quick fix, looking at long-term fix, looking at the person as a whole, looking at a community as a whole. I'm not just focusing on one community, but also focusing on everybody, because everybody deserves to be treated with the utmost respect, the utmost quality of care. So different people and different areas are affected by healthcare. Not just the United States, but all over the world. But it's some countries that have great healthcare. So just looking at how can America follow suit? How can we try to change policy? So how do we plan on fighting stigma? Through education, advocacy, research, policy, media, and most importantly, humanity. Just understanding that everybody is a human, everybody has rights, and we have to respect those rights of individuals, and not just what we want or just looking at the money aspect. Because right now healthcare in America is like this money chain, when actually it should just be making sure people are being treated equally and fairly. Public health is about protecting and improving the well-being of communities. So the thing I learned about public health is to look at the area that you're living in, look at other neighboring areas that one reflect your infrastructure and reflects what you're doing, and reflects something that if they're doing right and what they're doing wrong, and how can you implement those things in your area. The next thing you want to look at is the national level. So what is your nation doing about it? Then you look at a country that might have the same infrastructure or not, and seeing what they're doing wrong, what they're doing right, and how can we duplicate it, or how can we make our healthcare our own in combating these issues that we have and where we're living and where we're from. Advocacy means standing up, speaking out, and changing systems. So one thing about change is sometimes it will be hard and sometimes we will not want to do it. Everybody deserves health care. No matter what you look like, no matter where you're from, no matter how much money you make, no matter how much education you have, no matter what religion, no matter what background, no matter what, everybody deserves quality health care. Everybody deserves to be treated like a person, and everybody deserves to be heard. And sometimes as healthcare professionals, we have to be the ones to make sure that these communities or different communities and populations are heard. And how do we do that? Outreach. We basically go out into these communities and educate them on the disease, whether it's like COVID, obesity, diabetes, HIV, different healthcare tips, and then we also listen to their stories. And the main thing about going to different communities and hearing these stories is understanding that everybody have a story. I have a story, you have a story, and each of our stories are valid. No matter what political party you affiliate yourself with, everybody has a story, and everybody's story is valid. Everybody's lived experience can tell you something about them, and how can we change and better ourselves in America, and not in America but globally, across the country, across the world, in different areas, and to making healthcare evolve where we can all benefit from it, where we can be healthy, where people can get paid, not cut off, and have different resources to understand that there are things out here and we can create these things to make sure that the people that's doing the work can stay employed, and the people that are benefiting from the work that we're doing are actually being heard. Education gives people knowledge, and knowledge is power. When we think about equity and people that are not well aware about different things, it's because we haven't educated them. We haven't gone to them to teach them about different things. When we think about school, only certain topics are discussed. Only obesity, exercise, maybe diabetes are discussed in school settings. But what we're doing outside of school, how are we reaching kids? How are we reaching young adults? How are we reaching the older population? And now we have getting to the point where we are getting our information from untrusted sources. So who will be the trusted sources? Will it be us as healthcare professionals? Because everybody's not going to CDC website, everybody's not going to the World Health Organization website, everybody is not going to these well-known websites to get adequate information that is correct. Most of us are Googling our symptoms and trusting that, diagnosing ourselves, going on TikTok, and we have limited ourselves on thinking that everybody should be educated, and we're the ones who have to educate people. So how are we going to do that? We can't be silenced and be behind the scenes and scared to voice our opinions, scared to get in front of different people and tell them about these different things. Media is how we tell the story, how we change the narrative, and we all use it. So when we think about media is now on the rise. We have young adults, younger people, that are now using the internet like they never used it before. TikTok, Instagram, Facebook, Twitter, now is known as X, Snapchat, using these different sources, getting information off of these sources when they shouldn't be trusted. Looking at influencers, how can we have influencers, celebrities educate these different young adults, being in front? Also, the media has created a lot of stigma based off of the research that was done at that time. So now, like I said in the beginning of the video, we have, as healthcare professionals, we're going back and re-educating people on what is now known. When now we should just look at everything as a whole and just start using terms like, this is what we are finding now, and this is what is trending now at the moment, or this is what is true about this infection, this topic at this moment. Not saying, this is what this is and this is who is the effect. Because truth of the matter is, no matter what health concern you have, it affects you and everybody that's around you. Because if you're in care or not in care, it affects your family. Thinking about the well-being of you, it affects you, the people you work with. If you're working in the field, it also affects you as well. So now we have to go beyond what we're putting on the media, what we are allowing to be the voice of public health or the voice of healthcare in general. Healthcare has to get their voice back, and we have to have trusted people and trusted individuals educating these people, these different communities and different backgrounds on these diseases. We have to have equal representation. We have to have people that's across different age spans, lifespans, races, background, demographic, cultures, to be the front of these healthcare trends, healthcare education sessions. So basically, that is literally Endas Cares is just setting the forefront. The main goal of this video is just to introduce the face behind the movement, the face behind the brand, to show you guys and really explain the purpose of Endas Cares. I know I've been just posting just different healthcare resources, tips, and other stuff. So that's the main goal of that. We'll also be focusing on mental health, because mental health matters, your story matters, and with mental health being such a big topic and concern nowadays, it is important to address those concerns, educate people. That goes back to media. A lot of people are harming themselves because of what they see on the media. And with our current where we're at now, we have seen a lot of younger people commit suicide, whether they feel like they cannot talk to somebody, have somebody to talk to, or trusting these well-known individuals to tell them what they should do, how they should live, and they feel like they're not enough because they haven't met those standards of that person they're looking at. So it's just teaching individuals that our stories are different, and it's okay that your story will be different. Also on Endas Cares, we plan on being a podcast. We're bringing different people in front of the camera to talk about these healthcare concerns, talk about what we can do, how can we move forward. It will be different people from communities. It will be healthcare professionals, just coming to talk about different things that's going on currently, past, future, and present. What can we look for, and how can we change, and how can we shape our system? And that is the main goal of Endas Cares, is to shape our system and to change what we know as healthcare, and to create something better. Our mission here is to educate, advocate, and create for healthier communities by ending healthcare stigma through media, research, action. We highlight issues like mental health, chronic illness, trauma, infectious disease, health disparities, and more, because silence does not change lives, but because silence does not save lives, but understanding does. And that there is enough to just end here and just tell you guys to be on the lookout. Follow Endas Cares. Endas Cares, subscribe to the YouTube, because that's where most of the podcasts will be. We are not going to be on TikTok, so our main platforms is Facebook, Instagram, and YouTube, just because of the simple fact we don't know what's going on with TikTok. But I will use my personal TikTok to educate. So if you guys want to follow my personal TikTok to educate, you can. It is only _KK, if I'm not mistaken. But all of that will be in my personal description box. This is the end of the introduction of Endas Cares, what we're doing. We will be posting more, being more intentional about the different education. Any topics you want to discuss, please feel free to leave that in the comment section below. DM different topics, email different topics, anything that you want to discuss, be discussed, educated about. We are here to educate. First, research and learn. That is my main goal, is to research and learn, because I do not want to be another person to give false information, because false information creates barriers, it creates distrust, it creates a lot of things that we now as healthcare professionals are trying to fight. And that's one thing that we will be focusing on: breaking barriers, rising up voices, and building communities, and building the community to professionals where we both are trusted, we're both like family, friends, we both are able to collaborate, coexist together. We're able to be intentional. We're able to not have to worry about anything that disservices our industry. So that's the end of this video. I hope you like it. Thanks for watching. And again, this is Endas Cares, which stands for Ending All Stigma Care, with the founder, Michaela Drake. And that is the end of the video. Bye.